I'm Celeste Graham. I'm the Director of Education for the ACD. And I compiled this presentation with information from PARE and PORT, which is a Canadian institution, as well as in conjunction with Audrey Thurm and Emily Reinhart. So Audrey and Emily, you guys feel free to pop in if I leave something out or if you want to add something. All right. Um, so, our current research engagement is obviously the Parents Advancing Research Networks 2.0 Expand Community Tools and Engagement, which is our current project. And so we thought it would be good to just kind of review the goals of this because you are engaging in research by participating in this project. So one goal is to identify considerations that are important to selecting appropriate outcome measurement tools to evaluate meaningful changes in CTD and GAMP patients based on and as a companion to the outcome measures identified in the first PCORI grant that we completed a few years ago. And then the second main goal is to engage, train, and empower more caregivers to be active partners in research and help develop considerations by sharing their stories and advocating for the patient. So we are well on our way to achieving those project goals. The next slide, this just kind of reviews, this is a fantastic graphic that Emily created, and it reviews kind of where the timeline of things and where we are to this point, as well as what's coming up on the horizon. So we've done our exploratory jam, we're in the midst of all the trainings, parent interviews, most have been completed, the lit review, um, we've had some subject matter expert meetings, continuing those the trainings, but also adding the presentations from you guys, which have been incredible. And we are right at the point of the community survey. Um, Hopefully that'll launch soon, right, Emily, within the next month or so, a few weeks.
Yeah, that's the hope.
Perfect. That's the hope. Um, So we are, and then this project will wind down by September of this year. It's crazy to think. Um, so this is a roadmap that we wanted to review. It hones in on why we're doing what we're doing and how we're paving the way for others. Um, so Audrey, feel free to chime in. But you see there's several. Do you want to actually go over the roadmap?
Sure.
Okay.
I think I don't know how to make it bigger on my screen.
Mm,
Um, is there a way to make it bigger?
I don't know. Not
Yeah, I
that
don't
I.
know how everybody else is seeing it, but I'm seeing, actually, maybe I'll here. I figured it out. Um, oh, it's still pretty small. But you can see here that there's four, oh, perfect. There's four main groupings of what the FDA is calling the roadmap for creating fit for purpose clinical outcome assessments, which would be how we assess whether a drug uh, is successful or not, is useful, is effective or efficacious. And I think we've shown this several times now, but I'm just going over it again because hopefully it has different meaning as we've gone along this process together. Um, but what is the most important to them, and the first step is the understanding of the disease condition, which was so important in item number 2 there, the natural history, the vigilance study, which we're so excited that the results are out. The main results are out now, and we've talked about many times. But even before then should be the parent caregiver perspective. And I mean, that is the number one thing that this group has done such amazing work in creating the core outcome set process. There is a step that I don't think was done explicitly, which is like a disease concept model. But it's been implied by what was rated as important, and certainly for the PFDD meeting that was really laid out. Um, I think we certainly have the patient subpopulations in creatine deficiencies of CTD and CAMP, but whether there are other subsets, it is something that we're still learning about for this condition. We know, there's definitely some kids whose creatine is have more than others, so you might want to subpopulate that way or others. Um, and then what is considered proximal, which is really what we have as our core outcome set, those outcomes, but what might be more distal meaningful aspects of health, and that's more like quality of life of parents and missed work and all that kind of stuff. Um, so all those things. And then we've definitely gotten other expert input, and that was certainly a part of the first grant. And then conceptualizing clinical benefits and risks. So that comes from having outcomes. Then with those outcomes, you decide what are the concepts that are in them. And again, the core outcome set made that explicit. And you identify the context of use, and now you're starting to get into the specific clinical trial. So the use is very different if it's 6 weeks of looking at a, ADHD medication versus 5 years of looking at a gene therapy trial. And that's something that we can't do without knowing where the treatment research is. And Heidi's been amazing at keeping everybody in communication about what trials are potentially coming down the road and what those would mean and how long they would be. And importantly, the hardest part that is able to be defined is what concepts those treatments might actually affect. And that's where we just don't know when it's some of these mechanism modifying treatments, like just improving creatine. What will that affect first and when and how? Those are missing links that we still don't know. And animal studies can only get us so far in knowing that. And then from knowing all of that, that's when you would pick the best measure for a specific trial. And that's what, I don't know, mine is all cut off. I can only see half of that. But that's when you would, yeah, perfect, decide what type of measurement, whether it's a parent rating, which is an OBS row, observer reported measure versus a direct measure, a performance measure would be best. And then whether we have existing measures or we need to collect new evidence for measures and potentially modify them, or we need to develop new measures. And we've been working on all aspects of that, but that's where what we've learned from individual stories in this grant, from the literature review, and what we're going to learn a lot from the community survey is, what is most helpful from a parent's perspective, from the caregiver's perspective, of what types of measures would be deemed as most feasible, and actually importantly show the meaningful change in the constructs that we've been talking about. So I hope that is just a small summary of this in the context of where we are with this grant.
Awesome. Thanks, Audrey. I will figure out this slide sharing one of these days. All right. So, way back, I watched some informational videos and trainings from PARE, which stands for the Patient-Centered Outcomes Research Institute, which is where we have this grant from. It is in the US. And so this is just some information gleaned from that about patient-centered research. So, patient-centered research is stakeholder-driven, and stakeholders are patients, caregivers, clinicians, advocates, payers, others interested in the outcomes that are meaningful to patients at every stage of research. So if we look back at the origins of the patient-centered research, patients, caregivers, and healthcare providers haven't always been involved. I'm sure you guys have noticed kind of a shift over the years. when you, as you know, your interactions with medical providers and all of that. So, traditional research teams usually had more of a scientific focus. They would screen, diagnose, look at prevention, safety and effectiveness, complications, delivery of care, equity, and access to care. Um, and then we have a separate patients and caregivers. They need information to help them make, we need information to help us make day-to-day decisions, um, which then in turn helps improve quality of life, helps make treatment manageable, such as the amount of time it would take, and cost, as well as avoid complications. Clinicians have been focused on effectiveness of treatments, side effects, how a treatment could work differently for various patients. Um, and then you have payers and healthcare admin, how different prevention, management, and treatment options might change the way that care is provided. And then there's always regulatory. And so these have always kind of historically been separate, or, there's been some space in between them all. Um, but then it's been healthcare's been evolving to be more patient-centered. Um, to where patients have an active role in partnering with their care team, helping providers design care to meet the patient and family needs, working together with clinicians to make treatment choices, like weighing options based on benefit harm, as well as family values and preferences, incorporating useful and trustworthy information that helps um, everyone involved make decisions. And that's the key to patient-centered care. I know I've noticed personally a shift in that with Levi's care team over the past few years for certain. And so it's been nice to see that shift. I mean, there is still a ways to go. But just a little history. So in 2010, PCORI was authorized by Congress to increase the quantity, quality, and timeliness of research-backed evidence that can provide information. And then in 2019, PCORI was reauthorized by Congress for 10 more years. I just thought that was good information. So patient-centered research needs an active partnership from the study design all the way to sharing findings. So at the very, very beginning, all the way through, in every aspect of the research process. The goal is to leverage your patient caregiver lived experience and expertise to influence research to be patient-centered, relevant, and useful by not just checking a box, but jumping in feet first. So knowing your voice and your lived experience has meaning, giving insight to research in regards to clinical significance, identifying if results are meaningful and useful, identifying trade-offs um, between benefit versus harm, what results mean in the clinic, and then beyond. Teaching researchers the importance of collaborating with patients and caregivers, encouraging researchers to work together with other stakeholders, having fluid conversations, sharing their findings. It doesn't do much good if research findings don't get into the hands of those who can use them. And so I just think about, the meaningful conversations that we have every time we have an in-person symposium or an in-person meeting, especially where the researchers, the academia, the medical providers, they can lay eyes on a variety of different, our different kiddos within the community. And I think it really um, puts it all together for them. So it's important to get involved early, and that helps inform clinical trial prep, which is all of this is contributing to that. So an ACD creatine deficiency community example would be our first PCORI grant, looking at the core outcome set, deciding on that. The second grant, making recommendations for outcome measurement tools as we look towards clinical trials. And then also the EL PFDD that we did with the FDA, which resulted in the Voice of the Patient report. So there is documentation, a whole report that the FDA has of information from our community, from caregivers, from patients, to help inform them about what life with CTG and get creatine deficiencies entails. So, a couple of quotes throughout the training that I came across that stuck out to me. Patient and family engagement. Patients, families, their representatives, and health professionals working in active partnership at various levels across the healthcare system, direct care, organizational design and governance, and policy making, the end goal to improve health and healthcare. And then patients are the core of the system and should be at the core of the solution. It's kind of short and sweet, and I thought that was impactful. So all of that information was from PCORI. This next little bit of information is from PORCH, which is based in Canada, and it stands for Patient-Oriented Research Curriculum in Child Health. So there are international initiatives to promote patient and public involvement in research, and I'm guaranteed there are more than just PORCH. This is just the one that I came across. Uh, Again, patient engagement is emerging and it's a relatively new concept, generally speaking. For patients and caregivers, there's an increase in knowledge and skills, feel valued and empowered. We have greater confidence and emotional well-being as we share and are able to kind of talk about it. It's not taboo. And then we develop stronger and lasting connections to research, fellow caregivers, providers, things like that. Um, so one portion of this training talked about research participant versus research partner, and we'll go over a few slides more specifically related to our community with that in a minute. But participant means to participate and partner means equal. And so I just thought that those just kind of short and sweet, pointing out the difference between the two, but they're both extremely important. Patient and caregiver viewpoints lead to relevant, acceptable, and responsive research. It identifies priorities that matter and important topics to patients and caregivers. And then key principles of patient engagement, um, diversity, sorry, um, diversity, inclusiveness, support of research participants, meaning patients and caregivers, mutual respect, acknowledge and value each other's knowledge and expertise, co-production, so working together, and then being transparent, honest, and trustworthy, having that openness and transparency of the patient community. And then if we look at readiness for patient engagement, we think about time and resources, looking at logistics, the intended purpose, motivations, shared decision making and communication, and having a realistic plan for engagement. Um, there's a lot of conferences and things too that have struck up about patient engagement. And the spectrum of patient engagement is wide and large. So all the way from consultative to involvement to collaborating to empowering. As the spectrum progresses, more time and knowledge is required of all parties. So it really depends on your bandwidth, and your bandwidth may change through different seasons. Whether things are, you're on the struggle bus, which we've been a little bit lately, or, whether you have time and you're really passionate and in this season of your life you're ready to go for it. So it's all important. It's just a matter of your bandwidth and what you feel like your family can offer. All right, so as promised, this slide looks at being a research participant, so participating, practically engaging in the research process. So some examples we kind of talked about were enrolling and completing surveys in the creatine info registry, providing biosamples to Coriel, participating in the FNIR study at Boston Children's, joining the GAA blood spot study, and participating in a future MRS study. And Emily so graciously added this QR code. You can find out more research opportunities on our website, and that QR code takes you directly there. Emily, do you have anything to add to that?
No, just get involved. And if you have questions about opportunities or anything like that, give us a shout, especially with regards to the preteen info registry. There's a lot of new stuff that's going to be coming out with the registry this year. So definitely make sure that you're enrolled and caught up on surveys. Um, Shoot me an email if you have any questions about that. That's one of the easiest ways you can participate in research is participating in the registry. Yeah.
Awesome. Thanks so much. And then being a research partner. So contributing to research information, the research gathering, contributing to research information gathering processes. So some examples here, contribute ideas during research development. With the last PAReNts project, we did a Delphi process. Community surveys, one will be coming out soon. Parents project cohorts, you guys are all involved in that. Join advisory boards or committees. So join ACD, PCORI, NIH, or other funders, community boards and organizations, or local academic centers. Just however you can be involved and look to get the word out about rare disease and CCDS in particular. And then be an advocate, tell your story, speak up both one-on-one with researchers and at large gatherings like scientific conferences, like our symposium, um, things like that. So there's all different ways that you can be a research participant and or partner. And then I just have a slide for any thoughts, comments, or questions. If not, we'll go right into the presentations. All right. Well, Heidi, I will stop sharing my screen if you want to pull up the presentations.
All right, can you see my slides?
Yes.
All right, so our first presentation is from Micah.
Yes, thanks, Heidi. Yeah, the first slide. So yeah, my name is Maaike. I live in the Netherlands with my partner Desmond and our son Oscar. Oscar is 3 years old. He will turn 4 next month, so almost 4. I'm Dutch. My partner Desmond is Irish, but we live in the Netherlands. And Oscar's diagnosed with CTD, and he was diagnosed just after his second birthday, so just about 2 years ago now. And I will tell you a bit about how we got the diagnosis, the journey towards it, and everything that happened afterwards, and how Oscar is doing. So next slide, please. Yeah, so Oscar was born healthy, so we thought. So the pregnancy was pretty uneventful, but around 30 weeks, they noticed he was not growing properly, or he was smaller than expected. So I had lots of extra checkups in the last weeks of my pregnancy, and I then was induced at 40 weeks. And had to give birth in the hospital, even though home births are pretty common in the Netherlands. And everything seemed fine. He seemed like he was low in birth weight, so he was around 2.5 kilos. But he was healthy and doing well. And in the beginning, also growing well. But for some reason, and I could never really pinpoint why, I had a feeling something was not right. I was in a group of other women with this around the same due date, and we were sharing lots of experiences and photos and movies and seeing each other and seeing the other babies. I always felt Oscar was different than the other babies. It wasn't a serious concern then, but it was just something that was always in the back of my mind. And as a baby, he had reflux, but it wasn't so severe. So they always said, oh, that's normal. He had constipation, but not like seriously. He was uh, behind in his milestones, but not so behind that it was really worrisome. Um, and he had, especially when we started with solids, he vomited a lot. There was a period where he would vomit like every day after eating. Um, but it was never so severe that we got it looked into further. Um, and what was also noticeable was that he had breath holding spells, so he could cry so hard that he would turn blue and then pass out. But it was always just a few seconds. And also this we discussed with our doctor, and they always said, that's relatively normal. They grow out of it, and you just have to learn how to deal with it. Um, so this all happened, and then when he was around 1.5 years old, so the first breath holding spell he had when he was around 6 weeks, and they happened quite frequently, at least once every 2 weeks or a few times a month. Um, but always just a few seconds. And then when he was 1.5 years, he had a very severe breath holding spell. So he was in daycare at the time, and there he started crying. It's always for a reason, but not something major happened. He was just upset that he was put in bed. And he passed out and he was unconscious for 20 to 30 minutes. So the ambulance came, the helicopter came, it was a whole drama. But then afterwards, he was fine. As soon as we were in the hospital, he was happy and smiling and his normal self again. But this triggered more serious research on what was going on with Oscar. So we had a appointment with a neurologist. We did a 24-hour EEG. That was normal, so they ruled out epilepsy. But they did give us options on what else we wanted to do. And one of those things was a DNA test to see if there was anything genetic underlying and could explain all the things we had been seeing with Oscar already. So we thought, why not? Even though I felt there was something ongoing, we never expected anything out of this DNA test. But we said yes, and we did it. And then 3 months later, we got the results, and the neurologist called us and said, we have good news for you. We found something, which was crazy to me because we didn't expect anything because we did it mostly to rule out other things. But they told us that they found CTD, and that's how we got the diagnosis. And then, well, pretty much a whole roller coaster started with all other tests. And yeah, so that's now 2 years ago. We feel we're a bit more in our normal rhythm now. We've had the majority of all the tests. I think I'll go into that a bit later as well. But it's 2 years ago now. We've kind of, well, not accepted because we will never accept, but dealing with it in a okay way, I'd say. And Oscar definitely helps because he is the most happy and cheerful kid I know. Maybe you can go to the next slide, Heidi. He is content. He's happy. He's full of energy. He loves people. Well, he mostly loves adults. Kids not as much. He loves to explore. He likes to go out, see and do new things. So that really helps in finding our daily routine and daily rhythm with Oscar. So I find it difficult when you ask what's the impact on quality of life. I think the impact on quality of life for Oscar is limited because he is happy and cheerful and he is just himself. For us, it's more difficult, and that's the breath holding spells. There's always a feeling like, oh my God, what's gonna happen when he starts crying, and whether he has or will develop epilepsy. And it's always somewhere in the back of our minds. And what is impacting quality of life at the moment a lot is sleep. Oscar is a crazy bad sleeper. He very rarely sleeps through the night. And and is often awake for multiple hours a night. And it's unclear why. He just wakes up and it's like he wants to sleep, but he's unable for it. So he needs us for comfort. Um, he just wants us to be there and kind of hold our hand, um, which is nice in a way, but it's exhausting at the same time. Like the last week, he has been awake every night between 2 and 4. So that's something we are definitely struggling with. But we're getting help with that as well. We actually have our sleep test next week, and we've been getting lots of help to see more on a behavioral level what we can do to improve his sleep, but also with medication or other things. Yeah, I wrote here what's also impacting quality of life for us is travel. He gets travel sickness very quickly. Our range in a car used to be around 5 to 10 minutes, and then there would be lots and lots of vomit. I feel it's getting a bit better now. He's becoming older and he's more aware of his surroundings. He's excited to see a tractor or cows outside, and then he can look out the window and actually be involved. And I think that helps. So as long as we don't stop too often or are stuck in traffic, he is doing better now. Um, yeah, like I said, he's very social. He loves people. He mostly likes adults. He will just go up to anyone, say hello, and then nothing other than that. Um, um, and kids he finds a bit more challenging because they're more unpredictable, I think. He likes to observe them. He likes looking at them. He doesn't really play with them or really interact with them. And also in daycare, if there's a new kid or someone just for a day temporarily, he really is a bit shy and he observes them and he finds it difficult to come to his own play when 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 the surroundings or the other kids are different than he's used to. Um, Next slide. Oh, I expected three
There,
photos here, but that's okay.
let's-
Um,
there we go. I had to
oh,
click to
oh, that's
slow
okay.
mode.
Yeah, so Oscar's development is very clearly delayed in all aspects. So gross motor, fine motor, cognition, speed speech and communication. So we've done multiple tests to assess what level of functioning he's at. And at 2.5 years, he was at around 1 years old on all domains. And we had a test again a few months ago, so when he was about 3.5, and he was just over 2 years on all aspects of his development. So he's behind on all aspects. But what's the most important and the most amazing thing to see is that he's making lots of progress. So actually, I had this interview with Nathan almost a year ago, or like 9 months ago, when we made this presentation, and it was just great to see the answers I gave then and how that's changed to now, to see, yeah, the progress he has made. But I think there was 3 photos in a row here because I just wanted to show you that the progress he's making is nice to see because it really took him a long time to learn how to walk, for example, where he was, well, he wasn't crawling for a long time, and then all of a sudden, just one day he crawled, and then one day he just started walking on his knees, and he did that for, I think, over 6 months. That's just his way of walking. We gave him little knee pads because it must have been sore in his knees. So he walked on his knees for about 6 months, and we gave him lots of physiotherapy, and he just didn't want to do it. And the physio always said, he's gonna walk, and when he starts walking, he will just run off because he's building so much core strength already on his knees. And that's really what we saw as well. So then one day he just started walking, and now he's happy to run around. He's more into climbing and jumping now. So that's great to see. And I think that's typical for everything he develops. Just all of a sudden, then he's learned a new skill, or he's learned a new word, or he's doing something new. And it's really difficult to practice with him. It's like he doesn't care. If he's not able to do something, he's happy enough to do something else. Or he finds a different way of doing it. And then all of a sudden, when he's ready for it, he will do it. Um, So that's nice to see. Similar with like speech, I think I'll come back to that in a little bit. But in terms of adaptive functioning, so yeah, he needs help with lots of things. Um, and of course he's only 3, and we know he's developmentally only 2. So it's also difficult for us to sometimes see, okay, what part of his development is his disability and what part is just Oscar as a person and what part of it is just a normal toddler. So that's difficult to distinguish, but yeah, we are happy with all the progress he's making, and of course we're worried about the future where he'll be in terms of adaptive functioning and in terms of what he will be able to do. But as long as it's moving forward, we're happy, and that's what we're striving for. Next slide. Yeah, fine motor skills are behind. He finds it difficult. He's easily discouraged as well when something doesn't work. Like he seems very focused in this photo putting a block on, but if this block would fall off, all the blocks will be on the floor and then he's done with it. But he can also be real proud when it does work. So he needs lots of encouragement. He needs lots of enthusiasm from us. To be able to work on it. And what we also notice is that he really needs a lot of focus. So if stuff is happening around him or if he hears a noise somewhere, he just lost interest and he'll want to do something else, and his focus will be shifted from putting that one block on to something completely different. But also here he's developing. He's now able to use a spoon, for example, to eat his own dessert. And that's also something that just happened from one day to the other, where he figured it out that he can hold it and he can scoop, and he put it to his mouth and then scoop again. But eating with a fork, for example, is still a struggle. So he needs more encouragement and more help. He gets physiotherapy once a week in his medical daycare. That's really helpful. And we try to do it in a playful way, because what I just said, if we really try to push something or practice a lot that he's not into, it will not work at all. He will just get frustrated. Next slide. Yeah, this is funny because 9 months ago I answered, no, he's always happy and he's always cheerful and always full of energy, and that is true. He is, but he can get very upset quite easily. And what I just said, I don't know if that's just Oscar or if it's his disability or is it him just being a toddler. He's just learned the word no. So at the moment, everything is no, 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 no. Which is in a way also nice to see, but frustrating for us as well. And what's difficult for us is because there's always the fear of the breath holding spells. It's also difficult for us to let him cry. Because we're always kind of worried what will happen if we do. So he's spoiled. He usually gets what he wants. And he's our only child. He's also the only grandchild on both sides. So he is spoiled, and he knows what he can get when he cries. And when he is upset or emotional, it's usually quite short and easy to get him out of it. For example, he hates the hairdresser. It's impossible, but he likes going there. When I say, okay, we're going to get your hair cut, he's happy to go there. He's happy to walk in. He even like recognizes her because we always go the same one, and he realizes we're going to cut his hair because he says, oh, haarknippen, like cutting hair. He's happy, and then as soon as you put him on the chair, he's crying, screaming. And then as soon as you take him off the chair, he's happy again. He's playing, he's smiling, he's talking to the hairdresser. So it's difficult. Uh, like I said, it's difficult. Some stuff we really struggle with. I think some part of it is how we deal with him. Part of him is him just in his um, uh, toddler phase and his no phase. So we'll have to see how that develops further. Um, Next slide. On communication. Yeah, so this is a major wish of improvement for us, although he has been making great progress in the past months. Again, here, when I saw what I said 9 months ago compared to now, is he's making really impressive progress. So he is delayed in speech for sure, but he's now making lots of two-word sentences. Most sentences contain his own name, Oscar, and then what he wants or what he needs. Sometimes he makes three-word sentences, so that's a bit in his development where he is now. His pronunciation is not great, but we usually understand what he means from the context. Although what's making it extra difficult is that we are bilingual. So my partner speaks English and I speak Dutch to him, and we speak English together at home. And sometimes, and Oscar can really switch, which is amazing to see, because when I say something in Dutch to him, he will repeat it in English. So he understands the word and he can make the translation in his head and then also say that then to his dad. But he doesn't always makes the distinction between Dutch and English. So sometimes he says English words to me and then I have absolutely no clue what he means. Like, for example, when we walk outside, for a long time I was wondering, like, what does he say? Because when we're walking in a direction and he kind of aggressively says, "Wei wei," and I was like, I really didn't know what he meant until we were walking with the three of us, and I heard Desmond say, this way," and then Oscar responded, "Oh, wei wei." So he was just trying to tell me what direction he wanted to go in, but I never understood that. So that's the extra challenge in our family to understand what he needs. But overall, it's great that he can make clear what he wants, and if he cannot um, make it clear with his words, he will just grab us by the hand and show us. Um, so he will repeat the word many, many times and just much louder, but will also grab us by the hand and just actually physically show us what he wants or what he needs. But then if we still don't understand, he will get upset and frustrated. Um, he's doing some signs as well. The daycare that he goes to also does supportive signs. So for some words, he always uses them. And we try to do that at home as well. So he's picking that up a little bit as well. But since his speech is developing so much, we're mostly focusing on that. And he's getting speech therapy 2 times a week in his daycare, which is amazing. Next slide. Yeah, cognitive functioning also obviously behind. But what is great to see is that he understands us, and it becomes more and more clear to us that he understands more than he can show us. Like if we talk about something and we think, oh, he's not really listening or he doesn't really understand, he then all of a sudden says a word or he does something that that shows us that he did indeed understood what we were talking about or what we were meant to say. And he can do simple tasks. If we can do simple tasks, but he also really is now anticipating what's going to happen based on what we always do. And he's very much into structure. He wants things exactly the same way as it always goes. Like when we come home, we first have to hang up our coat, we have to take our shoes off, and he will not do anything else until we've done that. So Desmond was away for a few days a few weeks ago, and you would think he missed his dad, but he ran to the door and he just told him, hang up your coat, hang up your coat. And he didn't even want a hug or anything before the coat was off and on the and put away. So yeah, again, that's also improving, and that's the most important part for us. He's very curious. He likes to discover new things. Yeah, I think that's what I want to say about that part. Next slide. So seizures, convulsions, I've just discussed with you that he had his breath holding spell. That in my mind, I'm still wondering if that really was a breath holding spell or if it was maybe a seizure. We're still not too sure about that. He has had a 24-hour EEG that was normal. But it's always in the back of our minds that maybe it was epilepsy and maybe he will have more seizures. But for now, luckily, that's not the case. And those intense breath holding spells he has had 3 times now, where he was unconscious for more than 10 minutes. Um, and we now have emergency medication for it as well, a nose spray. We've luckily never had to use it since then, but it's good to have that just in case. And it's something that's not followed up on anymore at the moment. He's also been evaluated by a cardiologist because well, we don't know if maybe it was cardiac related. So he's had a 24-hour and a 2-week Holter showing to see his heart rhythm, and it showed some signs of an elevated QT wave, but or interval. But they said, well, we don't see it consistently. We only saw it a few times, and he has had breath holding spells during that 2-week Holter examination, and then they didn't see any changes in heart rhythm that were worrisome. So they say he may have prolonged QT intervals, but not consistently. So therefore, he doesn't have the long QT syndrome, but we're treating it as is. So in all his medical files, it says he has maybe QT. So we have to be careful with certain medications, but it's still unclear, and we will follow up on that in the next years. Yeah, and what I should say is that the breath holding spells are becoming much less frequent. So where they were multiple times a month before, now we see that it's maybe once every 2 months. So that's great to see. So it does seem like he's growing over it, or at least I think he is less frustrated because he can um, express himself in other ways. So he's just less frustrated um, now. When he does pass out now, it's usually it's not so much anymore when he's crying because he's unhappy or he's uncomfortable or he doesn't want something. It's mostly when he's in pain. So when he fell and he hit his head, for example, there's a higher likelihood of him passing out. Next slide. Yeah, these photos represent what we're currently working on as a family, I'd say. So potty training is something we're hopeful for. He is now able to tell us when he has a full diaper, and he loves sitting on the potty. So as soon as he tells us, I want to sit on the potty, that's usually after he's done something. But then we just put him on, and he likes doing it. So as long as that's a positive experience, that's what we're going for, in the hopes of him becoming potty trained at some point. Sleep is a major issue. So if anyone has any tips on that, they're more than welcome, although I feel like we've tried everything so far. Um, but but we've now accepted help as well. So we actually have a night nanny that comes one night every 2 weeks to the house. She then looks after Oscar, and we go to bed on our attic. We have a spare bedroom there, and we put in our earbuds, and we give the nanny the monitor, and we say, "Good luck. We'll see you in the morning." So it's already helpful just knowing there's one night we can look forward to where we can all sleep. And food and growth is a major concern for us. He's becoming an extremely picky eater. He well, basically it's spaghetti or fish fingers or sandwiches. That's what he likes, and all the other things he doesn't even really want to try. Um, um, and he's not growing well, which we know is also is a thing in CTD where they have low weight, but yeah, it's a concern mostly because it's a daily struggle because you think, oh, he's not eating, but he's also not growing. Am I doing enough? So he's now getting some extra high calorie drinks to support him. But again, he is always full of energy. He can be awake for half the night and then not eat anything the next day, and he's still always happy and just himself and so full of energy that we think, please just lay on the couch for a moment. Um, um, but yeah, that's something we're struggling with at the moment. Um, but yeah, overall, what I said many times, we see progress, and that's the most important thing, and that's what's giving us hope. Um, and and we do everything we can to support him. So we'll see where it goes. So thanks for listening. I tried to make it without crying, but it's just the last second.
Oh, I love hearing about Oscar. Thank you. Does anybody have any questions or anything they want to share? There's lots of comments in the chat. And I would love to take all the pictures and use them, but I won't do that. I would ask permission, but they're beautiful. You do a very, very good job of capturing his life and his personality.
Yeah, and I would also say, thank you so much for sharing. It sounds like there are so many similarities between Oscar and my son, Sonny, who's 6. And how old is Oscar right now? Is he 4?
He will turn 4 the end of next month.
Okay, gotcha. Yeah, so um I'm just like 2 years ahead of you in age. And so I feel like there's so many similarities and we've seen so much growth in Sunny between 4 and 6 that has given us a lot of like hope, like you said. Um, we are blessed with a good sleeper. I sleep trained Sunny when he was 6 months old, and that was pre obviously knowing anything was going on. And I don't know if that helped him or not, but I'm grateful for that. Um, but we're saying we're having the same challenges as far as picky eating and things like that. Do you feel like Oscar is growing in height, if not weight?
Yeah, yeah, he is growing in height, so that's why the doctors are less concerned I am
Yeah.
than I am myself.
Right. Yeah, and I think that that's a really big indicator of their continued growth is that they are making those gains in just different areas. Like the hypotonia issue, if Oscar has that, is going to be a big part of the weight. And I think, he looks happy and he looks like he likes to eat. Like the things that he loves, he likes to eat
Well, yeah, that
in
that
that
is true
picture.
because then we also know that when he is hungry, he will eat. He can have like an adult size bowl of spaghetti, or
Yeah.
like he'll have like 6 sandwiches for lunch. So then
Yeah.
when he wants to eat, he will eat. That's true.
Yeah.
Yeah.
So are you guys going to the symposium in person next year or this year, I guess it is?
Yeah, yeah. Well, I'm going.
Okay,
So I think it's a bit too far to bring Oscar, but I'm
sure.
going. So I'm excited to meet all of you.
Yeah, looking forward to it. But if you want to connect at all, I think we talk a little bit on Facebook, but I think there's a lot of us with kids around the same kind of general age, and I just, please reach out. I'm happy to just listen or share, what's happened with Sunny and my experience too, just with him. And I think I'm talking next month about Sunny too. Um, but I think some of that stuff, is helpful to just have someone who understands it. So just wanted to just volunteer that.
That's great. Thanks.
Yeah, I agree about, oh my gosh, he's so cute and your photos are amazing. And I'm very impressed by the bilingual skills that you shared. We don't have a bilingual home, but I find like that gives me, it's just encouraging to hear that our kids' brains, like that his brain is able to make those connections between the different languages. And I think that just shows there's so much potential. And it's just so much work to to get to our kids' potential with all of the challenges and getting them motivated enough to work on things, right? But and the utensil struggle, it's Cadman, yeah, it's he knows how to use utensils, but he just doesn't want to at home. He does it great with it at school, but so that's an ongoing thing for us. And the sleep, oh my gosh, if I were you dealing, I would be like bursting into tears just talking about the sleep thing. That is like that my heart goes out to you with dealing with that. I will say, I think it was kind of around that age that so we sleep trained Cadman with Davis Erler, who gave a presentation to the community right after his first seizure when he was like 20 months old, I would say. And even with all the sleep training, he did go through a phase where he was like waking up crazy early, like 4 a.m., or having those periods of time where he was awake during the night and sleeping on the floor. And I just didn't know what to do. But just kind of sticking with all of that over time, he worked through all of it and got through it. And his sleep is back to being great again. So there's a lot of components with that where it's like he has to be in his room by himself. He has to get to bed by a certain time. We don't go in there unless we have to check on him because we're concerned about his, if there might be a seizure, if he's sick, or, sometimes some crying is different than regular crying. But it was the initial sleep training was definitely a couple nights of a lot of crying. So those things don't work for every family, but it just really kind of sticking with all of that over time has helped a lot.
Yeah, I'm also hopeful. I guess it kind of makes sense as well if he's developmentally behind in all those areas, he may also be in sleep, and all kids will start sleeping through the night at some point. I guess that we're just keeping our hope that one night he'll just understand how to do it.
Right. I'm glad you have that
and
help though, because that's important.
yeah, I'm glad we've accepted that help because that was
Yeah,
difficult in the beginning.
that's smart.
Um, but we really like it. And what he has during the day as well, he'll pick up on any sound. Like there will be a dog barking in the far distance. He'll say doggy, and we're like, did you really hear that? He also has it at night. So like you have to like sneak out of the room.
Oh, right.
When he's finally asleep, I sometimes stand up and my knee cracks a little bit, and then he's awake again.
Oh, no.
It's
Oh my gosh.
yeah.
Yeah, like they make us do hearing tests on these kids because of the speech
Yes.
issues, right? I'm like, he can hear everything. Like, hearing is
Yes,
fine.
we've had hearing tests as well. We had to do it like 3 times because he couldn't sit still, and then the
Yeah.
conclusion was he can hear very well. Like, yeah.
Right.
Like I have a really quick question about, again, just impressed with the the fact that your family is bilingual and the fact that he can understand both. And so I apologize if you've already said this, but if you say something to him in Dutch and your husband says the same thing to him in English, does he understand both? Like, does he know, put on your shoes in both Dutch and English? Is that something that he like recognizes?
Yes, it seems
That's
like it.
amazing.
Yeah. So we really try to stick with me always speaking Dutch, and Desmond always speaking English, and sometimes that's difficult. Um, but it seems like he understands both. Yeah.
That's amazing. Yeah. Be able, it's one thing to like kind of, mom says these things in Dutch and dad says these things in English, but the fact that you both can be communicating the same things in two different languages and the fact that he can understand them both just shows like how receptive he is. So smart guy. That's awesome.
What do you and Desmond speak to each other if Oscar's not around?
We speak English.
You do.
Yeah.
Okay. Well, thank you, Micah. It's time for Desmond, or sorry, for Oscar 2.0. Kelly, thank you for preparing your presentation. I'll let you take it from here.
Hi, so yeah, I'm Kelly. Myself and my husband also have an Oscar who's 7. And we've got a daughter too who's 3.5, and not forgetting Rufus, our dog. We live in England, Warwickshire, which is about 50 minutes on the train from London. So yeah, it's a bit further away probably from some of you guys. Next slide, please. So our journey to diagnosis started around 7 years ago, when Oscar was born. He had a normal birth, and there was a few complications, but it was more from my side. He was our first baby, so obviously you're completely smitten, and we still are now with him. In the early days, Oscar also had issues with milk. He'd literally bring all of it up after a feed. Um, so after a few months, I gave up dairy, and he was combi fed. So with his bottle milk, we added a thickener to it. He started to keep some of it down, but again, he still had reflux the whole time he had milk, to be honest. His weight went up and down. We monitored him with the dietitian, and after a few months with the change of milk, it did settle down. His weight is still low now, but he's slowly putting it on. Oscar's head control took longer than normal, but he did get there. I think as because we was first time parents, we worried all the time anyway, but it came to around the 6 month mark, and we noticed Oscar still wasn't sitting independently, compared to other babies at baby groups. We were told don't compare, which is very, very hard when you're a first time parent not to compare to other babies. Um, but we spoke to other professionals, and they said, don't worry, things will come. We had a very, very good health visitor who we're still in contact with now. Um, and she also agreed that, yes, Oscar's not meeting his milestones. And then the investigations did begin. We had appointments with pediatricians, audiology, speech and language, all before he turned 1. The referral process in England is maybe a little bit different, but the health visitor said, oh, they might not even take Oscar on yet for the referrals because he's so young. But every department we contacted did take Oscar on. He used to cry an awful lot when he was a baby. I mean, he turned blue from crying, so we had to blow on him because he'd hold his breath for so long. And the doctor said to us, oh, he's just got colic. But from speaking to health visitors and knowing something in ourselves, we were like, this isn't colic. It was around the 9 month mark that I knew our journey was going to be very different compared to family and friends. I think, again, it was just something that was in me, to be honest. So Oscar was 9 months when he sat, 12 months when he crawled. We were told at one point that Oscar might never walk. He used to knee walk, so my mum used to sew knee pads into all his trousers because we was worried about his knees at the time. Um, they were told he might not walk because of his weight bearing, because of this hypertonia. But we did everything. So we did compression shorts, they were like Spanx. They used to pull him in so tight. He had checks on his legs, scans. But then Oscar being Oscar walked just before his 3rd birthday. And yeah, I can't put into words that feeling when he actually did it, from being told he might never walk. Oscar was around 2 when he had his diagnosis of global delayed development, along with hypertonia. He has low muscle tone, but he is very, very strong. I mean, he can pull things that even me sometimes can't even pull. So yeah, he's really, really strong. Myself and my husband all had geosequencing. We pushed for more testing because I just had this feeling that there was something more than global delayed development. We had the results back in January 2023, just after Oscar had turned 4. And I remember going to the hospital, getting the results, and we walked into the room, and there was 4 or 5 doctors, and that's when I knew there was definitely going to be something that they'd found. And that's when obviously we was given the results of CTD. Oscar's had a few other diagnoses along the way. He had autism last year, but we've been told that it's secondary. So without the CTD, he might not even have the autism because it obviously gets autistic traits from the CTD. Oscar takes creatine, arginine, glycine, and betaine. We're not 100% sure if they're working, but when we did start the betaine, we noticed that there was a few more sounds coming from him in terms of his communication. So we carry on with all of the supplements at the moment. Oscar draws quite a lot, and there's investigations going on for that still. But he has hyacinth patches, which he wears just behind his ear. School also believe that helps with behaviour, but what it is, it's travel sickness patches. But yeah, to be honest, when Oscar has them, the drooling is very minimal, so we just carry on with that. Next slide, please. So Oscar has so many strengths. He's literally the happiest child. I don't know another child who is as happy as he is. He's constantly in a happy mood. He smiles constantly at everybody. An example of this is he hurt his hand at school last year, and it was quite bad. And an hour before he had to have surgery on it, he was running down the corridor, smiling and laughing. And one of the surgeons pulled us to one side and said, "Is that Oscar?" And we were like, "Yeah." And they just couldn't believe that an hour before surgery, he was so happy. Oscar's very, very determined, and he doesn't let anything get in his way. And he continues to make progress in his own way. Obviously, the determination sometimes can turn into a negative, but we try and look at the positive side. Like I mentioned, he's very social, so he will go up to strangers, waving to them, he'll babble to them. When we have delivery drivers, he's talking away to them. He has a very strong bond with his sister. So when Isabel came along, the first week or so, she would cry and he would cry. And to be honest, that's just carried on now. So the bond between them, yeah, it really has surprised me. Oscar loves food. He just constantly eats, and he'll eat anything. So fruit and veg, pasta, literally anything. The only thing he won't eat is mushrooms. He enjoys swimming. He's so close now to swimming without a float. So that's one of the areas, because he enjoys it and it's helping him in terms of physio. That's one of the areas at the moment we are pushing. Oscar's come a long way in terms of instructions and small tasks. So yeah, we can ask him something and he understands it. And he's really, really good with change of routine. At school, they're like, "Oh, we did something different at school today, and it wasn't in the routine." But yeah, Oscar just gets on with it. He is a very good sleeper, and he does need his sleep. So if Oscar doesn't get his sleep, you can tell the next day. He has had sleep tests because, again, similar to the to Oscar's presentation before, he's gone through stages of breath holding as well. And he's had yeah, a number of sleep tests now, but everything at the moment has come back positive, but that's something they are monitoring. On occasions, Oscar will sleep for around 13 hours, which is just, yeah. We did sleep train him when he was very young, but he's just carried on the sleeping, touch wood. Oscar's currently non-verbal, pre-verbal. He's making new sounds now. This obviously is one of the biggest impacts on his daily life. Oscar's very hyper. He's on the go all the time. He literally doesn't sit down, so he'll get out of his bed and then he will be on the go constantly till he goes to bed. I think that's maybe one of the reasons that he does need his sleep. It can be quite difficult if we go to certain places because he doesn't want to sit down. So if we go out for dinner sometimes, he'll have his food and then he's up and he wants to go again. Yeah, I mentioned he is very social, but sometimes that can be a downside to him because other people won't understand. So he'll go up to people and he'll wave in their face and, he's just trying to say hello, but obviously that can then be very difficult when people don't wave back to him. Oscar does need help in most daily tasks, but he does always try his best. His pain threshold is, yeah, I can't believe where his pain threshold is, to be honest. I mean, he can bump into something, doesn't cry, and then a couple of hours later, we're changing him, and he's got a bruise. So that is something that we are really heightened on now because it's, one of the areas we are really concerned about. He doesn't see danger, so if he was walking by the road and we wasn't holding his hands or he wasn't in his pushchair, he would just walk across the road. An example of that is if the front door's open, Oscar likes to run, and we're getting older, but he's getting a lot faster. Yeah, he has a lot of appointments from hospital to therapies. He's under a lot of departments now. So he's under ENT, physio, speech and language, metabolic team, neurology, pediatricians, heart investigations, and ophthalmology. He's monitored for his heart. There was one time that his heart was slightly raised. They're not diagnosing him with anything, but we have to watch for any medications that he does take, which is linked to long QT, but they haven't given him the diagnosis of it yet. Next slide, please. Adaptive functioning. So Oscar does need help with all aspects of personal care, teeth cleaning. He's not toilet trained yet. It is an area that we are trying to focus, but we are in the initial stages. He's under the bladder department at the moment. He needs help getting dressed, but he can get undressed very quickly. So he will just walk around the house with no trousers and with no nappy on. But that's just become part of it now. If the neighbor answers the door and Oscar stands there naked. Oscar does draw, and obviously he does have the hyacinth patches on. Sometimes he'll get drools around his sores around his mouth now. So we have to put cream on. Oscar's a very good eater, but he will want to eat mainly with his hands. And obviously it's come up before, but using cutlery for Oscar, he's getting there, but he's not quite there in terms of scooping yet. But that's something we've been doing with hand over hand techniques. In terms of gene therapy, we probably would consider it if it was 100% safe, because it would help Oscar independence, but it would obviously have to be tried for it. Sorry, next slide. Oscar's delayed across all areas with fine and gross motor skills. He has OT as part of his therapy. As mentioned, Oscar's only started using cutlery, but he does need constant help with it. Oscar's learned to take his clothes off without fastenings, and he can unzip coats and things. So sometimes we have to put coats on the other way when it's really, really cold, because otherwise he will get really, really cold and doesn't mind it. Oscar's not using like a pen or doing letters or numbers yet, but he does like to mark make. So he will get crayons or marker pens, and he'll make marks on the paper, which is a really, really new thing. So we're so proud of him for it. We've started using an AAC with Oscar now. We're in the early stages for it. And he's using the iPad every now and then now, and he's starting to get familiar with the icons. So he can find, YouTube, or he can find Netflix. Next slide, please. Emotional dysregulation. So Oscar can be frustrated at times. He doesn't obviously like cleaning his teeth, and he'll get very, very upset. However, this only lasts for a very short amount of time. So we can clean his teeth, and then the next minute we've stopped and he's perfectly fine, like walking off to getting his books. This happens, this can happen quite a few times, but he's literally, after he's got over it, he's like nothing's ever happened. He never holds on to anything either. So if something's happened, where, for example, our daughter, who's 3.5, she would be upset for, 5, 10 minutes, but Oscar just within seconds is absolutely fine. Oscar will try and tell us something in his own way, and if we don't understand it, that's when again he will get upset. On occasions, Oscar will pinch us. He does it randomly, but we feel like whether it is his behaviour, but it seems to be more like he gets a reaction. And school have mentioned it could be because he's in the reaction stage, like a toddler would be. But it's something that we are working on with him at the moment. Next slide, please. So expressive communication is one of the biggest areas for us at the moment. So Oscar is non-verbal, but he is classed as pre-verbal too. He's come a very long way with his communication. The majority of the time he gets his needs and wants across to us. So he does that a lot by hand leading or pointing, eye contact, and uses specific sounds. So he can use, he likes the word "ba." So he'll go "ba" for bus, or "ba" for bye. He's starting to use some Makaton signs now as well, which we've been doing it probably a year and a half at home, but Oscar's now picked up 4 or 5 different signs for it. It's not exactly the correct way of signing, but it's very close. So that's really helped in terms of school and at home. We can have a conversation with Oscar again. It's not, verbal like in sentences, but we can talk to him to say, Oscar, do you want your dinner? Then next minute he's going over to get his plate. He's babbling to us. He'll pull out his chair. School use a combination too. So we use symbols. Obviously, we started the AAC device now as well. He understands a lot more information than other people think he does. It is sometimes hard with his communication because obviously he isn't non-verbal, but we can be talking about something, then the next minute he's fully understood it and he's gone to get it. So me and my husband the other day were like, right, we'll do nappy changes, then it's then it's bath time. The next minute he's gone and got us a nappy. So even though we think sometimes he's not listening, the next minute we know he is because he's fully understood it. So the expressive communication is one of the hardest areas because to make Oscar more independent, obviously with the adaptive functioning, would really help because it'll make him a lot more independent as he gets older. So we do have private speech and language at the moment as well, just trying to push this area as much as we can. Next slide, please. So cognitive functioning. It's difficult to know on occasions on cognitive functioning without the expressive communication. As we've mentioned, he understands a lot more than people think, and he understands a lot more than he can say. And his memory is very, very good. We've tested this, so it can be Oscar wears the train. He'll go to his cupboard and he'll get the train because he knows where it is. If we say, right, Oscar, we're going to Grandma's or we're going to Uncle Robert's, he instantly knows. Or, so we know his cognitive functioning is progressing. The problem solving is increasing too. So he's starting to do simple shape sorters now. And he absolutely loves posting things. So we do find a lot of things behind radiators. His concentration and sitting, I think that's one of his areas where if he could concentrate for a bit longer, then the cognitive functioning probably would come along too. Saying that, his concentration levels from where he was 6 months ago to now, the progression has been amazing. I mean, we can sit down now for 5, 10 minutes with him where, looking back at a year, we could never have done that. So yeah, he's definitely progressing. Oscar attends a specialist school, which was extremely difficult to get him into. However, he's making progress and he's meeting his targets. Like I mentioned before, he is progressing in his own way. Next slide, please. So seizures, Oscar doesn't have seizures, touch wood. However, this is something we are aware of, obviously with other children with CTD. So it's something we do keep an eye on, and it's something that every time we have an appointment with metabolic or neurology, they always mention it too. Next slide, please. So Oscar's put a lot of things into perspective for our family. I mean, even down to now, I don't work full time. To meet Oscar's needs, that he needs me more than previous. But we always remain positive with Oscar. The progress he's making has just been phenomenal. As people mention, oh, but he's not talking yet. But then if you look at the ways he is still communicating to us, the progress he's making for himself has been really, really good. Obviously, yes, times are challenging, I'm not going to lie, but yeah, things are difficult. But when Oscar gives you that smile, yeah, you just carry on with it. Oscar and his sister have created a bond as well, which obviously I mentioned before, but it's so nice to see them together. I mean, she's taken on a bit of a carer role, but we haven't even said anything to her. She would just sometimes go to speak to Oscar, speak for Oscar. If somebody goes to speak to him who he doesn't know, he'll just say, "Oh yes, Oscar likes that," or "No, Oscar doesn't like that." Um, of course, like other parents with CTD, we're unsure what the future will hold for Oscar, but we believe in being positive always helps us. Oscar currently doesn't seem to be following the standard academic route, however, has strength in other areas, and this is the areas where we're hoping, helping him, sorry, to develop. I just wanted to say that we also find the Facebook ACD group as well really, really helpful, and it makes us feel like we're not alone with it all. If there was one area that we could help Oscar most in, it would be the expressive communication. That's us.
Thanks, Kelly. That was great.
Thanks for sharing, Kelly. It sounds like our Oscars are very similar.
Yeah, it's crazy, isn't it? The similarities from when you was doing your presentation. Yeah, it definitely clicked with how our Oscar is.
Yeah.
How old is your daughter, Kelly?
3.5.
Okay. I have got my sonny who's CTD is 6, and then we just had a daughter, or our daughter is she's going to be 9 months in a couple weeks. So hearing you talk about their bond just gives me so much kind of excitement and hope for that similar bond that I'm already seeing. Um, so it's just really cool to see that kind of down the line for us, like what it's turning into for you guys. So thanks for sharing that.
Yeah, we didn't know how it would go, to be honest, because obviously Oscar was he was around 3.5, but yes, ever since, to be honest, after the first week of bringing her home, it was really strange. Like he started to bring nappies to her, and if he went to get a bottle, he'd get the bottle, and yeah, it's just carried on. But now, the way she is with him, if he's waving,
Yeah.
if he waves to somebody, she'll say, "Oh, Oscar's just saying hello," and you're like, "Oh, it's lovely. It's
Oh,
really nice."
so sweet. And I definitely saw that with Erin, you and your daughter and Cadman at the symposium, and just the bond of it's just I love the sibling bond is just so special that I'm so happy that I get to experience that now.
It really is. Yeah. And I find she advocates for him with me, like telling me, like, "Mommy, like leave him alone. He just wants you to leave him alone right now." And so I listen. I'm like, okay, like she knows best.